And yeah, thank you so much.
Thanks for
Yeah.
listening.
All right, so now moving on, I absolutely just love Angie actually sent me a little bio, and in it said, Angie knows the secret sauce to happiness. So I'm excited to listen to that. I met Angie, I hate to say it was like, 10 years ago when our boys were at Lisa's Playhouse. So it's been a lot of years. And every single experience I've ever had with her has been so uplifting, and she always just brings a smile to my face. So let's hear what she has to say.
Well, thank you so much for inviting me to this group, Robin. I had such a nice time last night getting to know a few people and learning a lot, of course, and I'm just so pleased to be able to take part. I'll give people maybe a little bit of my background. It's pretty similar to Allison's, actually. Born and raised in Sussex. I graduated high school in 94 from Sussex, and I moved to Nova Scotia. I went to Dal. I did a Bachelor of Science in psychology, and then I did my respiratory therapy diploma. I moved to Bridgewater, Nova Scotia, and I started working as a respiratory therapist at a little hospital there. Just loved it. It was a small enough hospital that we got to do everything as respiratory therapists. So we worked in the ICU, running the ventilators. We worked in emerge with the emergency patients and accidents, that sort of thing. We went to difficult deliveries, so babies who were C-sections or just having a little trouble with the breathing when they were born. We were able to go to those. We did lots of intubations. And it wasn't a teaching hospital, so we didn't have lots of people jumping in front of us to do the fun stuff. We got to do a lot of the fun stuff as the respiratory therapist. Fun stuff in that it was exciting, but also helped a lot of really sick people. But my favorite part of my job came probably a year or so after I started. I started working in the sleep lab there, and we just had a small little sleep lab cobbled together with a little bit of equipment that we had. It wasn't high-tech sleep equipment. Basically, it was me on one side of a wall and a patient on the other side of the wall. I had a baby monitor so I could listen to them snoring, and I had an oxygen monitor on their finger going through a hole in the wall to my machine. And what I did was I listened to them snoring, and I could see their oxygen level dropping down, and I took notes by hand all night long. I don't do that anymore, but that's where my love of sleep medicine sort of started. So what we did in that little sleep apnea lab was it just came out of necessity. We had people who were admitted to the hospital. They seemed to be fine during the day. Their roommates would complain about their snoring a little at nap time, but besides that, seemed fine. And then at night, the nursing staff who was doing all the monitoring were getting very concerned because their oxygen level was dropping into their boots overnight, and nobody could figure out why. So they'd give, Mr. Jones a shake, or I guess it would be Mr. Knickel a shake down in Bridgewater. That would be his last name probably, and get him to take a breath, and then his oxygen level would come back up. So in the end, they started getting us respiratory therapists to go look and see what was going on. Well, these folks were stopping breathing at night. It's really hard to heal from a surgery or a heart attack or whatever else you've had going on, maybe a diabetic incident. Really hard to heal when your oxygen level is dropping so low at night. And how are you supposed to get out of the hospital and go home? So what would end up happening is the respiratory therapists, I was one of them before our lab was developed, would go and sit by their bedside all night and watch them and see they'd stop breathing at night. I'm going to explain exactly what was going on here in a minute. I'd get the treatment out, really, basic at that time, get them treated. They changed within a matter of days, especially these very sick people, how they felt. They were able to start healing, get on treatment, and go home. So what our lab did in Bridgewater, and what I ended up starting my own business in Bridgewater and then starting up a couple of clinics in the Sussex area, Sussex and Rothesay, is I diagnose people with obstructive sleep apnea and then treat them for it with a treatment called CPAP, continuous positive airway pressure. So, sleep apnea is a disorder where people stop breathing in their sleep. Obstructive sleep apnea is because there's something obstructing their airway. Well, they don't have a tennis ball or anything stuck in their throat. It's actually their own throat tissue that's blocking their airway. This is very common. So if you've ever seen somebody doing this, I'll show you what it looks like. So Uncle Joe is laying on the couch after Thanksgiving dinner and he's snoring away. And then all of a sudden you look over and he stops snoring and you have a look and this is what you see. And he'll toss and he'll turn and he'll kick and go on. Well, that's exactly what obstructive sleep apnea looks like. And you may have even seen it in your own bedroom. Mostly happens, it happens more often if people are on their backs, but it can happen on their side. So you would think that would be mostly a problem for the bed partner because of the snoring, but it's actually a serious condition. When people stop breathing in their sleep, their oxygen level drops down quite a bit, or can, and cause problems with their heart. Their blood vessels can cause high blood pressure, diabetes, that sort of thing. But also that snoring and that stopping breathing can wake their brain up out of its deep sleep. It can happen anywhere from 5 or 6 times an hour. That's extremely mild sleep apnea. 20 times an hour would be moderate sleep apnea. And 31 or above times an hour would be severe sleep apnea. And this would be an event where they stopped breathing or almost stopped breathing for at least 10 seconds. So that example I gave, that was probably 5 seconds. That wasn't very long. It would have to be twice as long as that to be considered an event. So the most I've ever seen, it was in the past year, and I had a gentleman who was 139 times an hour. And he was a guy who drove from Rothesay to Fredericton daily. And he dozed off behind that wheel a lot. So it's, and really it's no joke. He did get treatment, but his doctor could have pulled his driver's license if he didn't. And he felt like $1 million afterwards. I mean, he really did, because he was getting good sleep. So that's my background. I'm so glad to have moved back to Sussex. And what I really wanted to do was help people with sleep apnea here in Sussex. But I'm also a certified clinical sleep health educator. And so I don't just do sleep apnea. I kind of like to educate about sleep in general. And I was really happy that Robin had seen the benefit between self-care and sleep. So it's actually a really popular topic right now. As we know, self-care is really, it's super important. And the people who tend to be wanting to focus on self-care now, a lot of us are women. And what is the first thing to go when somebody's at home running a house, has a busy family? We know they're putting in all that emotional work into the house, making sure the lunches are done, the laundry's done, everything's booked, the kids are in bed, the kids are bathed, all of that stuff. It's not always all the women, but we do carry a lot of it. And one of the first things to go is our sleep. We're up late to try and get maybe an hour to ourselves, like where we're conscious, like maybe catch a show or something. So our sleep does suffer. We've got little ones running in the night. If somebody's up sick in the night, it's usually mom who's up with them. Can't be helped, but we've got to be able to catch up where we can. So why is sleep so important? So there's 2 factors with sleep that we have to look at. We have to look at your quantity of sleep. So your number of hours that you make sure you have carved out to be in bed, and your quality of sleep, that those hours you have in bed are good ones. Okay. So when we're talking quantity of sleep, Robin and I were talking the other day, and she sometimes feels a bit more rested on like 5 hours of sleep. She'll wake up and she'll have a really good day. But after we got talking a little more, Sometimes you can feel really good after a little bit of sleep, but after a few days of not getting quite as much, you start sort of taking withdrawals from your energy bank. You're borrowing from yourself to kind of get through that day, and eventually you're going to have to pay it back. And sometimes what you'll see is people will pay back their sleep bank on the weekend, so they're kind of running. They're doing okay Monday and Tuesday, then they start sort of running on empty, and then they're running on a bit more caffeine. And what they'll do is they'll crash all day Saturday and Sunday. And I see this a lot with men, actually, who work a lot during the week. And a lot of my clients have sleep disorders. And when they first come to see me before they get treated, they have to work. Like, they have to be awake for their 8 hours. They get home from work. They usually fall asleep at supper time. Then they'll go to bed. And then what they end up doing on the weekends, when they used to do stuff they enjoyed, go out to the shop, go four-wheeling, spend time with the family, play on ball teams and that kind of thing, that all goes to the wayside. They don't enjoy that anymore. All they want to do is sack out on the couch and catch up on their sleep. And that can happen to women too. So you want to make sure you've got a good quantity of sleep. You got to have it. Really, people need in general between 7 and 8 hours of sleep a night. I tend to like 9 for me. Some people work best on 7. Those little old ladies in Italy who get by on 3.5 hours sleep that you read about in the Inquirer before, they're pretty few and far between. They exist, but there aren't too many of us. So really, you should make sure that you've got a good few hours carved out. So what that entails is making sure you have a decent bedtime, to get in bed early enough so you can get those hours in before you have to wake up. What dictates a decent bedtime is what time you wake up that morning before. So this morning, if I wanted to go to bed tonight at, say, 10 o'clock, I couldn't be sleeping until 9 or 10 the morning that morning. I would have to wake up a little bit early. And sometimes if you're wanting to get an earlier bedtime, you got to force yourself to get up a little earlier in order to do that. You will eventually get used to it with your body. Your circadian rhythm, it doesn't shift by a large amount in one night. You can kind of do sort of 15 minutes a night is about the fastest you would be able to do. So be patient with yourself, but try and get yourself 7 to 8 hours of sleep at night, like in bed with the light off. Okay. And your quality of sleep. So you want to make sure that time in bed is of good quality. So I'm going to talk a little bit about good sleep hygiene. So you want to create a good sleep routine. I know that there's some really good, some things that people use. They might use in the bath. They might use scented candles before they go to bed. They might use oils. Robin, is it lavender that's really good for sleep? It's lavender, is it? And so if you start associating something, and our sense of smell is so strong. It's so good at telling our bodies to feel a certain way. So if you walk into a warm house and you smell a turkey dinner, I mean, what do you feel like immediately? Well, a lot of people would feel sort of relaxed. I'm home. You think about mom, family, vacation, sleep, relax, all that sort of thing. And if you can put yourself together a nice little routine before you go to bed and pair it with a certain scent, that certain scent can start to give you that feeling if you're ever in a place that you can't create your routine. And it can kind of act as a shortcut for you for that nice routine. So you get like, you get your chai tea, caffeine-free chai tea, and you get, maybe something with a lavender scent. You get your bath going. So over that couple of hours before you go to bed, do some nice sleepy things and do the same thing every night. That'll start making you well on your way to a good sleep routine. You want to have a nice dark room. If anybody has ever worked night shift, and thinks they can sleep with the sun coming through the curtains, you really don't. You get about 2 hours less sleep during the day in a pitch black room. With light coming through, it's even less. Pitch black, as little noise as possible, or white noise is really good too. So if you have a noise maker or you have a fan, that can cut out loud noises in the background like traffic or if somebody's slamming a door. The white noise can kind of help. A nice cool room helps too. So you can have your blankets or a lot of us like to have a quilt on, but if you have a nice cool room that you're breathing the nice cool air, that can really help as well. Let's see, exercise. Exercise is really good to help us get sleepy. So if you exercise every day moderately for about 4 days of the week, it's been shown after 6 weeks, your sleep has improved by, you are now going to be getting about 75 minutes more of sleep than you were 6 weeks before. And that's just with exercise. That's better results than any sleeping pill has ever gotten in any study. So if you can add in for 6 weeks, moderate exercise 4 times a week, you've just kicked the sleeping pill's butt. So that's a much better way to go too, because you'll be getting your brain into its, we call it sleep architecture, and you want proper sleep architecture. So that's the stages of your brain waves. So there's slow wave sleep, and there's deep sleep, and there's dream sleep, which is rapid eye movement sleep. If you're able to get into your stages of sleep with exercise instead of sleeping pills, your percentage of each of those stays normal. Any sleeping medication you take will kind of mess those up. So you might get all kinds of light stage sleep, but you might get a smaller percentage of deep sleep and very little dream sleep. And without your deep stage sleep and your dream sleep, your emotions are out of whack because you need your dream sleep to get that. And without your deep stage sleep, you're going to find that your exercise routine is not kicking in like it should. You have a lot less human growth hormone produced in your body if you're missing out on your deep stage sleep. So your workouts don't go as far either. So really good to stay away from the sleeping pills if you can at all possible. Okay.
Eating. Going just back to your exercise, is there a time of day that you suggest is better?
Yeah, if you can stay away from the heavy exercise at least 2 hours before you go to bed, because when you exercise, you've got all kinds of adrenaline and endorphins going on in your system. That's why we feel so good with exercise. It's like a natural drug. It's releasing this natural feel-good hormone in our body. But it takes a while for us to metabolize that, our bodies to metabolize that chemical out. And if it's too close to bed, you're like really juiced up and you won't be able to go to sleep. It's like drinking a cup of coffee, okay? So just kind of hold off that. Probably after about 7 or 8, you wouldn't want to do too many burpees. You don't want to do too many burpees anyway.
Who likes burpees?
We hate them because they work. Eat a balanced diet. That kind of goes without saying. I think we know what happens when we eat too many carbs and sugar. We don't feel good. And if you eat too much of that stuff before you go to bed, you'll be, your blood sugar is going to be all over the road while you're asleep. You'll be sweating. You'll be, your blood sugar will eventually kind of bottom out on you a little bit. You're going to be getting heartburn. I mean, it feels good going down, but it's not worth it. You should stick to something kind of small, but high protein. Maybe some nuts, maybe some cheese before you go to bed is a good idea. Let's see on my notes. So the benefits of getting a good night's sleep. So it does boost your immune system. When we go to sleep, it's really a reset for our body and our mind. All of our processes in our body are regulated by hormones. So your blood pressure is regulated by hormones. Your hormones are regulated by hormones. Your kidneys, your pancreas, Your gut is all regulated by hormones. Your emotional hormones are regulated by how much sleep you've got. So if you can get enough good quality sleep, you're going to be in tip-top shape, and your immune system is going to work for you a lot better. You're going to be ready to fight off all of those bugs that we don't want to get. It helps prevent weight gain. So there's a couple of reasons for this. One of them is that when you don't get enough good quality sleep, you have an increase in your level of cortisol, and cortisol can help you. It's not much of a help, but what it'll help you do is store fat, especially belly fat. So getting good sleep can really help keep that at bay. It's you know, I wish I could say if you started getting all that sleep, you're going to drop that 30 pounds you've been looking to lose all this time. It won't, but it certainly will help. And getting good quality sleep helps us have the right mindset to get out for that walk after work when we really didn't feel like it. You've got better sleep, and also you can stick to an eating plan that you've created for yourself, instead of reaching for something that's going to give you a quick boost like chocolate. As good as it is, it's full of sugar and probably should be used as a treat. Improve your mood, improve your memory. So your mood, this is very important. I really like, what time am I at here, Robin?
You're good.
Okay. So one of my favorite parts of sleep is dream sleep. Rapid eye movement sleep. And the reason it's called rapid eye movement, most people probably know this, but if you've ever watched somebody sleep and under their eyelids, you can kind of see this. I don't know if you can see or not, but under my eyelids, my eyes are going like this. It's really weird to watch them. Watch your pet. They do it too. I don't know what they dream about, but their eyes do go back and forth. So what it means is that you're actually having dreams at that time. Your eye muscles still work. Your breathing muscles still work. Your heart muscle still works. In fact, your heart rate speeds up a little bit. Your brain activity is it's really active. It's not a resting stage of your brain, but there's a little switch at your brain stem that tells that when you go into dream sleep, your brain has this little, it's like a little light switch, and there's no communication between your brain and your large muscles. So you are technically paralyzed when you're in your dreams, and it's a protective mechanism. It's so you can't go around acting out your dreams. So when people have a problem with that brain stem, they can go acting out their dreams. So people who sleepwalk, it doesn't always happen in their dream sleep. They can sleepwalk in other stages of sleep, but some people will start acting out their dreams. I've had clients, I had a woman who used to sleep eat a lot. She was gaining weight, had no idea why, but there was these unexplained missing loaves of bread every day, or like all the leftover spaghetti was wrong. I had a lady who used to go, she didn't know what she was doing at night, but one morning she went to go to work and put her gloves on. She had frozen French fries stuck in the fingers of her gloves, like just this wild stuff you'd never met. And really you've got no control over it. So kind of scary. So luckily for most of us, we can't act out our dreams. But I had it explained to me once before, and it made a lot of sense. You know how your dreams can be really crazy, like they seem to make no sense at all. If you can think though about what the emotion is that's going on in your dream and what you're feeling at that time, often you can pick out, oh my gosh, that's how I'm feeling at work right now. Like you might be dreaming that you are careening down a hill on your bicycle and the brakes don't work, and it's just going like crazy and you're barely making the turns, and you're just feeling totally out of control, and then all of a sudden you like fly off a cliff and then you wake up. Well, you hadn't done that recently, but your feelings might be of fear, feeling out of control, You might be feeling angry that you're in that situation. You might be feeling guilty because you stole the bike. You might, so if you go through and pick out all those emotions, often you can pick out what it is, the situation in your life that's going on, that you're having those emotions. And that can help you see that that situation is in fact really bothering you. And you might be able to come up with some ways that, okay, now I really see what I'm feeling about that. I got to make some changes. It's a real window to what's going on in your life. That's my kind of favorite part. And it also improves your memory. So I like this, I've said this to people before because we've all experienced it. Have you ever been driving, like Allison, when you used to drive from Halifax back to Sussex, have you ever, like, you were, leaving Halifax, you were at Fall River, and then all of a sudden you're like, how the hell did I get to Truro? Like, you passed a whole bunch of exits and you don't remember them or anything. I mean, like, you stayed on the road, you stayed between the lines, but you don't actually remember any of that stuff that happened. Well, that's a very light stage of sleep. In fact, your eyes are open. You can keep, the wheels between the lines, but in a light stage of sleep, your memory isn't working. The stuff that's going by is not making it in to stick there. And you'll see this with people who are sleep deprived. They'll have conversations and they'll have no idea that they just had that conversation, or they'll forget everything that you've said to them recently. And it's because they're so tired that their memory isn't kicking in. And we do see a lot of memory improvement with people who get treated for sleep apnea. I've had a couple of clients who are elderly clients and they thought it was the onset of dementia, like they just sort of assumed it was. And as it turned out, their memory did improve quite a bit once that sleep deprivation was taken care of. So you can improve your memory as long as you're getting enough sleep and enough good quality sleep. There was just a couple of other little interesting things I wanted to bring up for you, and a couple of tips to help you with your sleep. One thing, I want to make sure that you keep an eye on your bed partner. If you've got a bed partner who tosses and turns a lot, kicks a bit, if you've got a mattress that's not one of those, if when they move, you move, and they get up, you move, you've got to address your mattress and you've got to address your pillows too, because you've got to make sure that what they're doing isn't affecting you. Also, if they're snoring or stopping breathing in their sleep, your sleep is being disrupted just as much as the person with sleep apnea. And it improves just as much when they get treated for their sleep disorder. So keep that in mind too. One little gross thing is when was the last time you washed or changed your pillow? So a pillow, after 3 years, if it hasn't been washed, it's about 3 times as heavy as it was when it was new. Skin cells, bacteria, and drool. So be sure to pop your pillow in a nice hot washing machine on sanitize and dry it too. And then that'll kill any of those little dust mites and stuff that get in there. If you have trouble getting to sleep, or you wake up through the night and you can't get back to sleep, I have 2 really good tips. One of them is it's a little thing I listen to, and I've had a few people try it and they really like it. It's called Sleep Stories for Adults. There's podcasts and there's also YouTube channels. All you got to do is on YouTube, just search Sleep Stories for Adults, and you can pick which one you want, and they are like magic. It's a very specific way that the narrator speaks. The cadence is very slow. They have certain pauses that allow your brain to kind of stop and drift off. They don't have any harsh tones to the language, and the stories are just, they're soothing and nice little stories, nothing too interesting to, make you want to stay awake, but they're very sort of gentle stories. They work wonderfully for getting you to sleep. Another trick is the 4-7-8 breathing technique. You may have heard of it by Dr. Andrew Weil. He's the Mediterranean diet guy. So he's the guy who really introduced North America to the Mediterranean diet. So if you guys want to just do a little exercise here with me, I'll explain to you first what we're gonna do. So the 4-7-8 breathing technique, what you do is, so if I wake up in the night and I can't get back to sleep, what I do is you breathe in for 4 seconds, you hold your breath for 7 seconds, and you breathe out for 8 seconds. So first, let's do this. I'll just count on my hands. So let's breathe in for 4. Hold for 7. And out your mouth for 8. Even after once, that feels pretty good, doesn't it? I've never made it to 3 times of doing that cycle. So there's a couple of things that it does. When you breathe in like that and hold your breath for 7 seconds, holding your breath in your lungs are expanded like that. They've got positive pressure in there. That positive pressure in your lungs actually pushes on your heart a little bit so that your heart can't pump quite as hard. And that lung expansion also stops the blood flow from your coming back to your heart a little bit. So what it does is falsely lowers your blood pressure. That lowering of your blood pressure tricks your brain into thinking you're really, really relaxed. Okay. The counting, when you're counting like that, the 4, the 7, the 8, they're a little bit strange numbers. It gives your brain something to chew on instead of all the crazy stuff you did at work and what you should have said when she gave you that funny look and all those things that kind of bother us during the day. It helps us to not be thinking about that. So it tricks your brain into thinking of something different, tricks your body into thinking your blood pressure is really low and that your heart rate is really low. And I think it's really like, it's almost like magic for me. I've never made it past 3 times, and that's from being wide awake. So I'd suggest that one if you wake up through the night and you can't sleep. What's anything else I have? Screens. So like I was saying about walking around with the phones, this is my last little tip. Really hard to get away from screens at night. So here we are, it's dark out. I've got like a blaring light in my face so that you guys don't see all the wrinkles and stuff. You know, I'm used to doing these YouTube things. So I got shadow down here instead of gobble. I got tips. I got tips. So with the screens, it is hard to get away from those, but you can go to the hardware store and buy these really funky looking safety goggles. They're yellow or orange in hue, and they actually block all of the blue spectrum of light that comes from all of our devices. It blocks all that blue spectrum of light, which actually tells our brain that it's morning time. So all the TVs, the screens, are telling us, hey, it's not nighttime. They're telling our brains that it's sunshine and it's morning, and our brains start shutting off the serotonin that it should be releasing. If you get these glasses that block the blue light down at Kent, you're going to be falling asleep a lot quicker than you would have, because right now, if I had a pair on, my body would start producing this serotonin, which would tell me to start going to sleep. Right now, it's shutting off. They've got really expensive versions of these glasses. Those safety glasses at Kent or Canadian Tire are cheap, and they have more blue blocking quality than the really, really expensive ones. So great stocking stuffer too for the kids, and make them wear it. If you want to stay on your phone, then you got to wear these glasses at night and they'll go to sleep a lot better. So I think I'm probably good and out of time. Oh, I am very good. So does anybody have any questions or anything that cropped up?
I guess I'll take that as a no, maybe. Um, I'm trying to think.
Oh,
It
Mary
just-
Beth, do you have a question? I saw you talking.
oh, you're muted.
There. Okay. What do you call those glasses?
They're actually in the safety glasses section.
Okay.
Yeah, and they don't say anything on them about blue blockers or anything, but they're yellow or orange. And if you get those ones, they've actually tested how much blue light they block, and those block light better than the $60 glasses that are sold specially to block the blue light. Yeah, and that you can actually get them so they fit over your own glasses, and put them on after supper, and you'll probably find you'll get sleepy a lot sooner than you normally would.
Okay, that's good.
Awesome. I think you answered my question, and I'd be really, really interested in, so what kind of procedure is it when you're getting someone to do a sleep diary that you had mentioned?
Mm-hmm.
And I also wonder, like, if somebody was actually like wanting to know like what that quality of sleep is, how do you know if you're just, do you have to go to somebody like you to find out that quality?
So the testing that we do is mostly, well, it's all breathing channels. So we've got a device that it's got a little thing, you know, like oxygen that people wear that tucks up their nose. It's like that, and it tells us when they're breathing in and out. It's just a device they wear at night before they put it on before they go to bed for 2 nights in a row. Little thing tucks up their nose, a little belt that goes around their waist that tells us when they're breathing in and out. The little thing up their nose tells us when they're breathing in and out and if there's any snoring. And there's an oxygen sensor on their finger that tells us their oxygen level and heart rate. We're just able to see people's their physical breathing channels that are going on when they're in bed at night. We can't even technically tell if they're sleeping or not, but you can tell if somebody's sleeping and they've got obstructive sleep apnea. You know what works really nicely is those Fitbits, and you can get apps on your phone or your Apple Watch. Those work really well. And I've had clients that have brought me the data from their Fitbit, and I've compared it to the data on their CPAP machine. So that's the device we use to treat obstructive sleep apnea. And you can see the times where they kind of looked like they were having either they were stopping breathing a little bit still with the mask on. You would see restlessness on their Fitbit too. So they're pretty good at telling you. So do you have a Fitbit or something, Robin, that you'd be able to tell what your quality of sleep is?
Yeah, I'll take my husband's. I used to have something called a leaf, and it just looks like a little bracelet, and it's not syncing to my phone anymore. So that's on my Christmas list. I want a new leaf. And there was something I wanted last year. I think it was called a Muse, and it was some sort of a headband that you wore while you were sleeping. Have you ever heard of that?
Yes, I saw that too, and it was something to do with when, I don't know exactly how it worked, but it looked kind of, I looked into it one time. It looked kind of neat. Anything like that that gets you to pay attention to the quality of your sleep and try and get yourself to relax. The Muse, I think, was somehow able to read, I suspect it read probably heart rate or something, possibly respiratory rate too. And so you would be able, and it would give you a tone or something, and you would be able to kind of work to, if you slowed your breathing or your heart rate, it would give you some sort of a feedback. It seemed kind of neat, but I didn't really look. I don't know too much about it.
Yeah, I thought it was really, really cool too.
Yeah,
and
it
I
looked
had a girl
kinda cool,
that told
yeah.
me that she loved it, and it was like really improving her quality of life as a whole. Like getting the better sleep, moved into wanting to work out more, moved into eating better, moved into
Oh, geez.
yeah. So, but I mean, I think that's, you know, once we start to work on the one thing that we identify as our issue and we improve it, then it just gives us that confidence to continue to improve.
Yes.
So if nobody has any more questions for the girls, then I'm just going to kind of circle back a little bit into yesterday.